March is known across the world as a Women History Month, and it is a celebration of women's contributions to history, culture and society. It has been observed annually in the United States since 1987. Celebration runs from the first day of March through the 31st. While it is time to celebrate women and their achievements, it is also time to take stock of how their rights are fulfilled in the world, especially the right to health. Decades after countries signed pledges in the 1995 Beijing Declaration and Platform of Action, women still face many health problems. The world has now been urged to recommit to addressing them. To look at these health issues and prefer a lasting solution is a consultant obstetrician and gynecologist, Dr. Chito Nwana. Dr. Nwana is the medical director, CEO of TABITHA Medical Center in Abuja. Good to have you on Newsday, Doctor.
Nice to be here.
All right, good. Now, March as a month dedicated to women globally, how significant is it to mark this period from a health perspective, you think?
I think it's very significant because as a women's health provider, we know there are very many significant health issues that disproportionately plague women that are kind of overlooked, and we still need to do a lot of work on. I rather focus on some of the health, I believe, conditions that we tend to overlook. One of them is heart disease in women. And I always tell people that even though the life expectancy of women seems to be longer than men all over the world, we still know that that doesn't really translate to women living healthier lives. So one is heart disease. Women are less likely to be screened for heart disease, despite the fact that heart disease kills more women in the world than any other condition, including cancers. I also look at the issues like mental health. We can't continue to ignore the impact mental health has on our health, physical health, and other parts of our wellness. And that's something that, because of stigmatization, is not yet out there in the forefront, especially in Nigeria. And I think we need to start looking at that as it connects to other physical conditions that we tend to deal with on a daily basis. Other issues for me that people don't tend to ignore are things like malnutrition. You know, with the hike in prices of foodstuff, we're seeing a lot of, especially in rural areas where people cannot feed. And if you're malnourished as a woman, you will definitely fall, much more significantly to even minor medical conditions that plague us, including pregnancy and other reproductive health issues. So another major issue is pregnancy and childbirth. Yes, we're doing better when you look at the indices for maternal mortality, but there's still a lot of work because we don't yet have a lot of women that don't have access to specialized care, especially our high-risk pregnant patients. And so I think that gap needs to be bridged until to connect between our primary health care centers. And and one thing I don't want to forget is violence against women. Many people don't see this as a disease, but I see it as a plague. I was a gynecologist, and many times I have to take women to the operating room to fix damages caused by violence. But that also, I see the scar and effects it has on other aspects of their health. There's, the heart disease, things like infertility, many things that tend to just, really scar them for life mentally. And so I think that, women's health issues are so significant. There's something Michelle Obama said that I think makes this so true. She said, communities and countries and ultimately the world is as strong as the health of their women. And I think this is what makes, I just mentioned a few because of course there's several, but I wanted to just highlight those ones that seem to be ignored a bit, that I think very, very relevant to our general health as women.
Indeed, Dr. Chito, you just mentioned heart disease, mental health, malnutrition, violence against women, but I'd like to pay particular attention to cancer, including breasts, ovarian, and cervical. Where are we as a country in terms of screening, prevention, and treatment?
Well, I believe that where it concerns, we know already that breast cancer is, I guess, on top of the list in terms of the most common cause of death when it comes to cancer in women. Women's cancers is breast, cervical cancer is right after it. So I think that when it comes to enlightenment in terms of screening, we still have a lot of work to do. I think it's still very, I want to use the word elitist in a way. I think that making mammograms more affordable is key in actually battling things like breast and cervical cancers in low-income nations like ours. So I think that when it comes to that, I think we're better at awareness. We have more nonprofit organizations. We have also governmental agencies that are doing some good work in that area, but there's still lots of work to do. I'm particularly interested in cervical cancer, and I've done research in that area. I remember when we came and we did a research in incidence of HPV, which is the virus that actually is one of causes cervical cancer, and we wanted to see if the incidence was different between here and the U.S. When we did the study, we saw that the incidence of that virus is literally the same between here and the U.S., but the cervical cancer rate is significantly higher here in Nigeria, and that shows that one of the gaps there is that we don't screen, and that is something that has to be made affordable. It's still quite expensive. We're talking about people trying to eat and take care of basic needs. They're not necessarily going to bring out that amount of money to be able to go and do a mammogram or a pap smear on their own. So I think the government needs to put that into a primary health care package, an initiative that allows people to access that, or when we not get to the bottom of it, we'll still be doing late diagnosis in those both cancers that significantly do kill our women. So I think that's what my take on where it concerns where we are right now. We still have a lot of work to do.
Indeed, interesting perspective there, Dr. Nwana. Now, earlier you talked about bridging the gap, and how proactive or otherwise are government health authorities in addressing preventable maternal mortality, as you also mentioned earlier, and what role can private health practitioners such as yourself play here?
Well, I will say that, being that I really don't work for the government, I don't want to say go out of my level, but I believe that where I am in the FCT, I had a discussion once with the head of the primary healthcare board, and they seem to be very passionate in finding ways to bridge this gap. And I think at least the first step is recognizing that these gaps exist. I think once you recognize it, that's the first step, because some people don't recognize this. I think they recognize it here, and I think being able to bridge that and to work through that is very important. One of the things I've always said is that there must be a framework, right, where the public and the private, the government, public health sector, private health sector can create some kind of engagement that allows us to reach universal health coverage. I don't believe that it's possible for the government to actually achieve this SDG goal number 3 without the private health sector. As I speak, I think some of us are considering trying to partner with the Primary Care Health Board, and that's something that we've thought of in TABITHA, to work through their primary health care center to deliver specialized care. And we hope that works, because that may serve as a template for other private practice, how to engage with a government to do this work. And I think that's where we look at, and that's where I think there's a huge gap between private and government. And I think that gap needs to be bridged. And I think the pandemic showed us that it's so important to navigate anything that we have to do it together.
And Dr. Chito, it's good you mentioned the HPV, because most women these days are advised to get their daughters vaccinated against the HPV. Now, I want to ask you, at what age do you recommend? And is there any truth it affects fertility? That's one. And is it effective for women who take it well over their reproductive years?
Well, the age range, actually people could start taking HPV is 9. But based on my practice and my experience, I believe that mothers are more comfortable in giving this vaccine at the age of 11. And it's also given to both girls and boys, by the way. Okay. So I think that the HPV vaccine taken around the age 11 is where we can start. And the HPV vaccine is a great innovation. I get all my patients to take it. It is still expensive here, but I try to encourage. It's a 3-dose. You take it 3 times. It's a kind of like a month, and after a month you take it after a month. It go a month and 5 months. So it's like 3 doses, like the hepatitis B. So I really encourage people to take that, and it does not affect fertility. It's actually, I always tell people, if you have something that can prevent a cancer, why not? Well,
that's where we're going to have to leave it now. Dr. Chito Nwana, very great to have you, my friend, roommate, and classmate for many years. Dr. Chito Nwana, thank you for joining us on Newsday.